One of the things that I think drives us the most at Vision for Life is the outcomes. We're outcome driven, all of us. We're constantly taking the outcomes that we get and re-entering that into the equation so we can continually improve upon our outcomes. And that's really important at Vision for Life, because how you see afterward is really the most important thing. I'll give you an example. When we do LASIK, we calculate what treatment is the right one for that patient based upon the thousands of treatments that I've done already that we constantly input into the system. So the system is constantly updating. If I have a patient who is X diopters of nearsightedness or astigmatism, what are the results that I get? And that's from thousands upon thousands of patients constantly being re-entered into the system, and we don't ever stop. So even though I've done thousands of surgeries, we still enter that next patient's data in there to refine and better the outcome. With lens replacements, same thing. We did a clinical trial several years ago on the first trifocal lens in the United States. There were only 12 surgeons in the country who were asked to do the trial, and we were honored to be one of the 12 practices in the entire country to do that. When we did that clinical trial, they monitored our outcomes, and we were closer to about 94% within that half a diopter. So we weren't in the top 1%, we were probably in the top 0.5% in the entire world. And that's what we pride ourselves on, but it's never good enough. And I'm driven to try to always get better.